Today's medical-centric topic is kids and food allergies, identifying and managing symptoms. Food allergies in children are a major concern for many parents as they can lead to severe health issues if not properly managed. This guide provides insights into what food allergies are, how to recognize their symptoms, and effective strategies for managing them. Understanding food allergies in children. A food allergy occurs when a child's immune system mistakenly identifies a harmless food protein as a threat and reacts against it. This reaction can cause symptoms ranging from mild to life-threatening. Common food allergens in children. The most common food allergens affecting children are milk, eggs, peanuts, tree nuts, wheat, soy, fish, shellfish. Symptoms of food allergies in kids. Symptoms of food allergies can vary widely, but some common signs include skin reactions, hives, itching, or eczema, gastrointestinal symptoms, nausea, vomiting, diarrhea, or abdominal pain, respiratory issues, wheezing, shortness of breath, coughing, or nasal congestion, anaphylaxis, a severe, potentially life-threatening reaction that can impair breathing, cause a dramatic drop in blood pressure, and affect heart rate. Symptoms include a swollen throat, difficulty breathing, a severe drop in blood pressure, pale skin, dizziness, and fainting. Diagnosing food allergies in children. Medical history and symptom analysis. Discussing the child's symptoms and their timing in relation to food consumption. Skin prick tests. Small amounts of suspected allergens are placed on the child's skin, usually on the back or the arm. A positive reaction, typically swelling and redness, indicates an allergy. Blood tests. Measure the presence of immune system chemicals released in response to an allergen. Elimination diets and food challenges. Removing suspected allergens from the diet to see if symptoms improve, followed by controlled food reintroduction under medical supervision. Managing food allergies in children. Avoidance of known allergens. The primary treatment for food allergies is strict avoidance of the foods that cause symptoms. Education. Teaching the child, family members, and caregivers about the allergy, including how to recognize and respond to symptoms. Emergency plan. Having a clear action plan for dealing with allergic reactions, which may include the administration of antihistamines or epinephrine, adrenaline, depending on the severity of the reaction. Carry emergency medication. Children with severe allergies should have easy access to epinephrine autoinjectors. Early recognition and management of food allergies in children are crucial to preventing serious health consequences. Regular consultations with an allergist, vigilant monitoring of dietary intake, and educating those involved in the child's care are vital components of effective allergy management. With careful management, most children with food allergies can lead healthy, active lives.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.